Hello and welcome. Today we're diving into a rare and often overlooked cardiac condition, primary cardiac lymphoma, or PCL. While lymphoma commonly affects the lymph nodes and other organs, PCL is when it originates directly within the heart. It's a challenging diagnosis, so understanding its intricacies is crucial. The exact cause of primary cardiac lymphoma remains largely unknown. However, several factors are suspected to play a role. Immunodeficiencies, such as that seen in HEVS or in patients undergoing immunosuppressive therapy after organ transplantation, appears to increase the risk. Epstein-Barr virus (EBV) infection has also been implicated in some cases, particularly immunocompromised individuals. Genetics and other environmental triggers are being actively investigated as well. When lymphoma cells infiltrate the heart, they disrupt normal cardiac function. This infiltration can occur in various locations, including the myocardium, pericardium, and endocardium. The presence of these malignant cells can cause structural damage, leading to arrhythmias, heart failure, and even cardiac tamponade, where fluid accumulation around the heart compresses it. The specific effects depend on the size and location of the tumor. Primary cardiac lymphoma is exceedingly rare, representing less than 2% of all cardiac tumors and a tiny fraction of all lymphomas. It's more frequently observed in adults, particularly in the 4th to 6th decades of life. The true incidence is difficult to determine due to the diagnostic challenges and the possibility of underreporting. It tends to occur more commonly in immunocompromised individuals. The signs and symptoms of PCL are often nonspecific and can mimic other cardiac conditions, which can delay diagnosis. Common presentations include chest pain, shortness of breath, dyspnea, fatigue, palpitations, and swelling in the legs and ankles, edema. Some patients may experience arrhythmias, such as atrial fibrillation or ventricular tachycardia. In severe cases, the lymphoma can lead to cardiac tamponade, resulting in a rapid decline in health and potentially death. Diagnosing PCL is complex and requires a high degree of clinical suspicion. Initial investigations may include an electrocardiogram (ECG) to assess heart rhythm abnormalities, an echocardiogram to visualize the heart's structure and function, and chest rays or CT scans to look for masses or fluid accumulation. However, the gold standard for diagnosis is a cardiac biopsy, where a sample of heart tissue is taken and examined under a microscope to confirm the presence of lymphoma cells. Immunohistochemistry and flow cytometry are also crucial for characterizing the lymphoma subtype. Primary cardiac lymphomas are predominantly diffuse large B-cell lymphoma, DLBCL, an aggressive type of non-Hodgkin lymphoma. Other, less common subtypes include T-cell lymphomas and less aggressive B-cell lymphomas. Correct classification is vital as it influences treatment decisions and prognosis. Treatment for PCL typically involves a combination of chemotherapy and, in some cases, radiation therapy. The specific chemotherapy regimen depends on the lymphoma subtype and the patient's overall health. Rituximab, an antibody targeting a protein found on B cells, is often included in the treatment for DLBCL. In cases of cardiac tamponade, pericardiocentesis, a procedure to drain fluid from around the heart may be necessary. Cardiac surgery may be considered in select cases to debulk large tumors or alleviate specific complications. Stem cell transplantation is sometimes an option for relapsed or refractory disease. Because the exact cause of PCL is unknown, specific preventative measures are difficult to define. Maintaining a healthy immune system through a balanced diet, regular exercise, and avoiding known risk factors for immunodeficiency, such as HIV infection, may be beneficial. Early detection and treatment of underlying conditions like autoimmune disorders may also play a role in reducing the risk, although further research is needed. The prognosis for primary cardiac lymphoma varies significantly depending on factors such as the lymphoma subtype, the extent of cardiac involvement, the patient's overall health, and the response to treatment. Historically, the prognosis has been poor due to the aggressive nature of the disease and the challenges in diagnosis and treatment. However, advancements in chemotherapy and targeted therapies, combined with earlier diagnosis, have improved outcomes for some patients. Ongoing research is focused on developing novel therapies and improving diagnostic techniques to further enhance survival rates and quality of life for individuals with this rare and challenging condition. Investigational therapies include CAR T-cell therapy and other immunotherapies. Research into the role of EBV and other potential triggers is also ongoing. Thank you for joining us today.